I might just run something by you. On one, it's a friend now that has come to me, and we've just gotten her started on Japanese style. She was interested in it. Um, she'd have a long history. Health-wise would be, in general, her health wouldn't be great. Her biggest problem, really, for the last few years is she lives with a lot of spasm-type pain around the area of the common bile duct. Now, it is classified, there is a condition, I'm not sure exactly what it's called, and there are a certain amount of people worldwide who actually develop this. The surgical intervention is something like going in and maybe cauterizing some of the nerve plexus supply. So there's no easy medical intervention for this. So she self-manages it, really, through diet and meditation and so on. But she feels recently it has become a bit more aggressive. Now, there are triggers like stress and so on that can do that, or even positions at rest. Even, excuse me, driving for too long periods of time can be a trigger. But she also has a history of having had a spinal surgery where they fused, I think, between L4 and L5, and she had fusion between C6 and C7. In the past now, this could be maybe 15, 20 years ago.
Okay.
But certainly the spasming that she's getting in this region behind the, what's that, Mary?
Xiphoid process?
Yeah, the xiphoid process. That spasming seems to be more aggressive, she thinks, in recent times. More frequent, more aggressive, and she has to meditate longer to control it and to manage it. Diet-wise, she's very mixed bag with diet. I mean, she lives a lot on very alkaline type foods, very bland. We take a lot of yogurt, those kinds of foods. So diet, I'm not sure how great her diet is, but that's how she's managed it with diet, and she hasn't really made any recent changes with that. Anyway, to cut a long story short, we did introduce the Japanese style last week, and we did the palpation, and some of her reflexes were very obvious. I've only started her on a very minimal amount of points because she feels even back points will be way too much for her. And position-wise, she finds it very difficult to get into position. So we kind of did her a semi-recumbent, really.
Okay. So one suggestion I would have for someone like that who maybe can lie down face up for 5 minutes, but not much longer, do the palpation and you're checking off the points on the table, lying down as flat as you can. I mean, with you can have a pillow under the knees, and and then after you've determined which points you use, then kneel them when they're in a, you put them in an armchair or whatever, but at least you figured out the points in a better position for palpation.
Right.
If possible. Now, some people you can't even do that. You have to do everything sitting or whatever.
Yeah.
So you do what you can. So I wouldn't take that too seriously. I wouldn't let that deter you too much.
Okay.
So, so a few things. So there's two. Well, I'll give you some ideas for treatments. And you didn't tell me what findings you did find. Do you remember what you found on her?
I did. She had Oketsu, and she had liver 14, and she had Ren 17, and she had left abdominal stomach spleen area.
Okay, which suggests, is she constipated? I mean, are we talking about left spleen?
Yes, she can veer, but she would tend more towards constipation than loose.
Okay, and is the liver 14, I'm assuming, is on the right side?
Yeah.
Okay. So she appears to, so from a palpatory perspective rather than a historical perspective, well, she does have, bile duct spasms, which can put her in a gallbladder liver category. We don't know, because it could also, by the way, be a pancreas issue. But she appears to be a liver. Your findings suggest that there is a liver situation. Your Ren 17, I mean, we're just doing it by dogma, right? So for the sake of it. So she appears to have a liver possibility. The REN 17 suggests more likely than anything anxiety, because she says, I meditate in order to control this, the spasms, etc. So, and stress makes it worse. So let's call REN 17 the anxiety reflex in this particular case. And the left spleen stomach line below the navel on the left side will suggest that that's something to do with constipation, which may have to do with the liver issue, the beginning of the digestion process, or the beginning of the intestinal digestive process, is hampered. Or it could be the other way around. It could be that the motility of the intestines isn't good enough. Okay, and therefore at the beginning stage, there's this backup, more towards the rectum, and then over time, the front valve is going, wait a second, I keep wanting to push down, and they back down there are not accepting, so it starts, it's a possibility, but we don't know which is which. So let's look at. So you want to look now, does she gets uncomfortable on the table, which suggests that she actually has pain or spasms. So for example, if you press on the OD sphincter point, stomach 22.
Oh yeah, okay.
Is that painful, do you know? Because that's not quite liver.
Where is that?
So if you go from the navel to the ribs at 45 degrees, halfway
is the OD point.
Okay, I don't know. I hadn't checked that actually. I must check that next time. She does have a very bloated, and I mean really bloated abdominal region. It is like a balloon, and she feels that's worse.
Okay, so there's a good chance that she also has some sort of pancreatic thing going on.
Yeah.
Because
so, yeah.
which again feeds to the OD sphincter. So let's look at all our components and let's see, and then you check what helps the best. So if somebody has a bloated abdomen, it's very easy because you can tell. You just lightly press with your whole palm, and they go, oh yeah, it's bloated. They may not go ouch, but they can tell that there's a difference when you press on points. With the bloating, so that's it doesn't have to be pain, but there's a certain discomfort with bloatingness. So let's and this is not necessarily in order of priorities, because we don't know. And it will not be so in order of priority, what I would do is strangely enough, I would release the REN 17 first, or that would be like one of my priorities. And the reason why is because if it's stress, and if by diagnosis she has a Western diagnosis of let's cut off some nerve connection, I would rather address the autonomic nervous system first.
Okay.
So with REN 17, you basically kind of have two treatments, but quote unquote. So one of them is spleen 3 prospericardium.
Okay.
Now, notice that the spleen 3 is also what you would release spasms in general. And also notice that spleen 3 is what you would release OD sphincter point.
Okay.
So you kind of, there's a fairly good chance you're going to want to use spleen 3. There's a fairly good chance. Okay. Then you can, and the other area you'd want to check the spleen 3 against is your left spleen stomach lines. Okay, just to see how much that does. It gives you extra confidence. Okay. You may on the left side add, no, sorry. You may, by the way, check the spleen 3 against both the neck and the L4, L5. L4, L5 supposedly is better with spleen 9, but it doesn't mean that spleen 3 can't do the job. So you're basically looking for, so you took like, okay, REN 17 is spleen 3 is also for spasm, lovely point, blah, blah, blah. Here I am on the spleen channel. There could be other points that might work better than spleen 3, so you can check them, but I would start with spleen 3.
Okay.
So depending on how much patience you have and how much patience she has, you starting with spleen 3 and then you're exploring more. maybe spleen 9, maybe this, you know, whatever. You might check
Okay.
spleen 2, spleen 2 is painful, maybe spleen 5 and 9 is a better idea. So you've got a bunch of options. But the chances are you will end up with a spleen point, and there's a high chance you'll end up with spleen 3, possibly with more. There's a very good chance you'll end up with a pericardium point for a number of reasons. We're starting with nervous system and REN 17. That's the first. Then the other thing about REN, we're still on the REN 17 idea. You want to, before you do the pericardium, actually, the first thing you want to test is your Sanjiao 5 or 8, usually 8, but if it's a very rapid pulse, maybe it's Sanjiao 5, to release, if she has anything on the SCM, but also to release REN 17. And if Sanjiao 8 works to a certain extent, but not great to release REN 17, look if immune point does better, also an extra job.
Okay.
Yeah. Next, another thing that releases the autonomic nervous system and releases the diaphragm as well is bladder 2.
Okay.
Okay. Because you're describing it sort of as a REN 15 area slightly to the right, as opposed to, you know, because normally if you're looking at the OD area, it's gallbladder, it will be quite a bit further down than REN 15. So anything to do with REN 15 area, REN 17, REN 15, bladder 2 often does a good job to release it. Okay. I can, you know, you can look at it as a coordination of 3 diaphragms. You have a perineal diaphragm, you have a diaphragm, and then you either have a throat diaphragm or you have like your upper dantian, you know, like there's like a skull area, there's a space in the skull behind the bladder 2. So there's a resonance between bladder 2 and the diaphragm.
Okay.
So those are, and again, this is, I'm just checking. I can needle afterwards. I can decide, oh, which one. So each one of these points, just check first of all against REN 17, against the symptom itself, against the constipation reflex, check it against everything. So you're starting with this point I derived it from REN 17, anxiety, stress. Okay, spleen theory, pericardium, Sanjiao 8, REN, you know, but it doesn't mean that they should, if they're going to work, they should work for every other, to some extent, for all the other reflexes. They should not be limited to the reflex that you derive them from.
Okay.
Then also check, you know, so yes, you have a liver constitution. So we now address the spasms. We address the anxiety, or at least we're hoping that we did. Okay. Anxiety and spasms. Now let's look at the the liver issue. Okay. Now with the liver, you need to distinguish between when she has on liver 14, whether it's liver 14 or under the ribs, is it sharp pain or is it dull pain? And you need to sharp.
Yeah. Sharp.
Okay.
Yeah.
Okay. So if it's sharp, there's a chance you have a number of options. First of all, check if liver 2 is painful. If liver 2 is painful, start with liver 4, liver 8, and see what that does. Now, there's a chance that this liver thing is actually really coming from gallbladder. So if it's gallbladder, your treatment is right-sided, gallbladder 43, 44, metal water, and Sanjiao 1 and 2, all on the right side. Okay. If it's not, so if that proves to be now, that doesn't touch the liver area, maybe it does something, but it's, you know, look at your other liver treatments. So if liver 2 is painful, you do liver 4, liver 8. If liver 2 is not painful, look at the possibility of the liver excess treatment, because you say it's sharp pain, which is right side. And I know everybody gets confused on this one. So this is all on the right side. Kidney 7, spleen 7, heart 3, needle downwards, and pericardium 4, needle downwards towards the fingers. Okay, so that's kidney 7, spleen 7, heart 3, pericardium 4. That's the so-called liver excess treatment. So now, of course, you can't check all 4 points together. You can check maybe 2 of them at a time. And that treatment may not work, even though she has excess liver. And then if that doesn't work, go for level with, say, do 20 on the gallbladder channel, look to see if there's a dent, especially because if someone's stressed, that point may be a better point. And then also don't forget, I know this is a little unusual for me to say, she does have oketsu. And you don't know if it's a constipation or not. So see if oketsu releases
Okay.
the liver as well. Okay.
Okay.
So, yeah, I mean, you could just do oketsu and hope for the best. And, and if it doesn't clear everything, fine, no big deal. You two needles, liver 4, lung 5 on the left, not the end of the world. It's just that in my experience, oketsu has not been a terribly prominent feature in patients for the last 10, 15, well, maybe 20 years now. Okay, it's a big finding theoretically, in the way that the style is taught, but it's not as big a finding practically speaking. So, so that I tend to not jump on it immediately. But on the other hand, wow, it's unusual. She has it, and maybe this is the post-COVID world. Is oketsu? How do I know? Like maybe oketsu is going to have a big comeback. So I would definitely consider treating oketsu and seeing what else is left, but knowing that's not the only thing you should do in all likelihood. Okay, and then the last thing that you can consider adding, you already have on the right side, you have the gallbladder metal water, or conceivably you have it because of the gallbladder issues. On the left side, you may look at stomach 44, 45 metal water. Okay, so to kind of try and clear out the intestinal stuff. Now, it's not uncommon for people to have intestinal stuff showing when there's a liver issue. So it's more likely that liver is the primary here, and that's also where the official issue is, or in the vicinity. The last option of treatment, or the last protocol that I'll give you again to try out, is adrenal, okay, with possibly lung 5 and spleen 5. This is the treatment for pancreatitic abdomen. In other words, if she has a puffy beam going across REN 12, stomach 21 to stomach 21, which is kind of the area, at least on the right side, that she's complaining about. That's the treatment for what's termed pancreatitic abdomen. Okay, and it's adrenal because in pancreatitis, you basically, steroids are the treatment of choice, or at least used to be. Okay, so those are your various kind of go-to protocols dogmatically that I would look at it in the case like she's presenting.
Okay.
And then I would choose which one. Then if you can do the back, and if not, at least sitting, you should be able to do, at the very least, you should be able to do small intestine 11. See if on the right side, small intestine 11 is puffy, and surround it with needles. That would be the very least I would do on the back.
Okay.
But I would also look at T11, T12, and T10. T10 because it's gallbladder, and T11, 12 is sugar points, which are also good for spasms.
Okay.
So, because obviously a person who can't lie down, doing their back is much more complicated. Especially if you're going to start looking at, can I do bladder 35? Yeah, bladder 30. Yeah, 35. Because it's very hard to get access to bladder 35 when in fact it's impossible to get access when they're sitting, unless they're sitting on a toilet and you're inside the toilet needling bladder 35. It's not going to work. So, I hear the popes have a chair like that so they can check that it's not a woman. They ordain them. But anyway, so, you're a little bit more limited in the back. Also, for example, a point like do 2, which may be a great point for nervous system, is that much harder to do when someone is sitting, because they're not sitting on do 2, but where are you going to get the needle between the seat and them? It's just hard. So your back may be a little bit more limited. If you definitely, sorry?
I'm just thinking, would she lie on her side?
She might, maybe, I'm not sure. She might try it now on the second one. You see, I suppose the spinal fusions have reduced a certain amount of her movement, really quite a bit. I think
Yeah.
she has maybe 3 or 4 vertebrae fused.
Yeah, and that can be conceivably okay, so if you have a spinal fusion that's then restricting your movement in the torso, and you're kind of like a little, don't want to make fun of the patient, don't take it wrong, but if I just don't have another term, if they're becoming a little bit robotic in their movements, so imagine what happens to the organs. The organs are also like this. Eventually they tighten and stiffen, and that might actually be the cause of it. And or it could be that the spinal fusion has damaged something around T10, T9, something, the area that feeds it. So actually it will behoove you to at least check the back sitting, fine, no problem. Because it's possible that it's actually all these fusions, because she has a fusion at the top, she has a fusion at the bottom. That the whole torso has been rigidified, whatever the word would be. And that could, theoretically, that could be the source. And then what you really want to do is release the spine in order to sort of start opening up some space for the organs.
Yeah.
Okay, so if you reach that conclusion, I would look at gallbladder 39, and I would look at side gallbladder 27, meaning take rend 4 and go all the way to the side, both of which you can do with someone sitting up. You don't have to actually go to the spine.
Okay.
All right. And I would look at do 16, by the way. Just to kind of open the spine. It's far enough away from her fusion, which is lower in the neck, because her fusion is in C6, C7.
I think it's C6, C7, yeah.
Yeah, so do 16 is enough away from it.
Okay.
You can also look at T5 area. It's a curve in the spine that could affect the rest of the spine. So, it might be that the spine is really the issue. One has to ask oneself, unless she had a clear injury that caused these fusions, one has to ask herself, what pre-suggested in her body these fusions? Like, why did it get to that situation?
It wasn't anything she was never very active. She was never very sporty. She really, I'm not sure whether it's just a family type. She's quite tall. Her long bones are long. I don't know what really put her in that situation. She was a teacher. It wasn't that she had, any history of major robust type of work or laborious work.
I wasn't suggesting, no, that's exactly the point, that exactly if it's not an injury, then what is it in the body? Was there some sort of, whatever you call it, let's call it X. We don't know what it is. Somebody can say, oh, it's a calcium metabolism. It doesn't matter what it was. The thing is, if you say, how come this person had this deterioration of spinal discs that required, and you may not have the answer, but what you're saying is, if I can address that, if I can somehow open the spine, so for example, sacroiliac ligaments, spleen 9, gallbladder 39, if I can address the spine, if I can put a little bit more plyness or fluidity in the spine, even though it's fused already, so in the surrounding tissue, if I can give some space and fluidity to the spine, will that release the holding pattern that's locking in the spasms? It's just a suggestion of something to try to look into. It doesn't mean it's correct, but it's just that, rather, because otherwise what we're saying, okay, you had a spinal fusion and yeah, that's done, you had surgery for that, and maybe it's related, maybe it's not related. We don't know. My job is to try and figure out, is there some part of the current issue that's tied into the past history, the spinal fusions.
Okay.
And so what I do is I try and address what I think is addressing the spinal fusion. And if it addresses everything else, I go, oh, okay, there's looks like it's related. And then the only way I really know is when the patient comes back the following week and they say, oh yeah, it's much better. Now, since I don't work in a way that says, I'll just do the spine because I'm curious and see what they come back with next week. I try and do everything that seems to affect the body. So I'll actually never know which was the real,
Okay.
shall we call it the trump card?
Mm.
You know, it's like I never really know which are the real points that did it,
Mm.
because I'm always taking some insurance. You know,
Yeah,
whatever,
I know.
as long as it releases, as long as it makes sense and it releases the abdomen. That's why I check all my points first to know which ones are worth it. And I needle afterwards. Just because a point released a certain area, I don't start needling it, because if that area disappears, if that reflex disappears, it's no longer available to check more ideas.
Okay.
Does that make sense?
It does, yeah. Mm. Yeah. Thanks, Evie. Yeah.
Yeah, let us know.
Yes, I will. Yeah. I'll be seeing her between now and the next time I'm on with
Cool.
you. Okay.
Next time they allow you to travel.
Exactly. That's true. I won't be a lawbreaker. Oh God.
That was one thing we were just discussing of it before we came on, was if there's pressure pain on gallbladder 24, would you normally just go to gallbladder 44 and 45?
43 and 44.
43 and 44.
Yeah. Most likely, the thing is, gallbladder 24 is a little bit undefined. I mean, how can you really tell the difference between gallbladder 24 and liver 14?
Well, we were trying to.
Yeah.
We were really working hard at it.
Yeah, not worth it. I mean, you know.
And we found pressure pain on both.
Oh, well, then. I would say this. The diagnosis of gallbladder will tend to be first of all, they don't usually show on liver 14 and gallbladder 24. In other words, on the ribs, they show under the ribs when you press in. The actual moo points are not as active as the diaphragm under the ribs. And the reason why is because that what happens is the liver is pushing on the diaphragm. And if you really want to be sure, what you can do is you ask the person to breathe in and hold the breath, and then you push on the diaphragm on the right side. Okay. So it's just more likely to show that way than on liver 14 or gallbladder 24. Now, yes, gallbladder tends to show more lateral and a little bit lower than liver. But the way I usually go that it's gallbladder and not liver is by history. If they actually have gallstones, or they had, I would go much more with that than, oh, this location is this and this location is that. The other thing is when you tap on the lower ribs on the right side and you go like this, it's painful with stones. But not everybody with gallbladder sensitivity. You also have to accept that most people with gallbladder problems will come from usually two areas. Well, there's probably more, but they can come from the liver. Okay, in which case the whole thing is kind of semi-moot, a liver or gallbladder, or they can come from the pancreas. Okay, or from the direction of the pancreas. Okay, it's very common for people to have inflamed common bile duct. It's a common duct. Okay, so the effect can come from a weakness. That whole area can be weak, and therefore it's not really gallbladder, but because the duct itself is not, quote unquote, milking the bile right, then the gallbladder is never being, I don't know if emptied is quite the right word, but it's not flowing well, and eventually it gets sandy or stony. Okay, so but that doesn't mean that the problem was really with the bile or with the gallbladder. It's more the sphincter, and that the sphincter was affected by maybe an inflammation in the pancreas or something like that. So it's an area that you can't always be sure what the etiology is. Okay? It could come from the liver, or it actually could come from the other side, or it could be the gallbladder itself. So that's why I'm suggesting, look to see what happens when you're dressing, when you're addressing each one of these possibilities. Is it pancreatitis, which may well be because she has bloating everywhere, which may be from constipation, but it may be from lack of enzymes also. You don't know until you try. Is it liver? I'm trying to treat the liver and seeing what happens. Or is it gallbladder? So you have 3 different options. Plus, in this particular case, you also have the option, and it's always an option for everyone because it's a sphincter, of a nervous system control. Yeah, anything to do with sphincter, it's like you want to release the SCM.
Right.
Okay.
Yeah.
Anyone else?
Yeah, thanks.
Well, I have a question. Have they definitely ruled out cancer or parasites or anything like that? Have they ruled that out completely?
She's a herbalist, so she treats herself with lots of herbal remedy. She'd be a qualified herbalist, so she has looked at all of that. It's not cancer because this is, a 10-15 year history now, and she would have had scans in the past. So
okay,
yeah.
okay, just curious.
Yeah.
I figured if they were recommending a nerve option that she had been checked out, but it's just a concern in that area, especially Avi's
Very
talking
much
about
so, yeah.
pancreatitis, because pancreatic cancer goes so undetected for so long. It's usually stage 3 or 4 before people know it, because they just chalk it up to other kinds of symptoms like, oh, I'm bloated,
Yes, and it's a good it is worthwhile looking at that, Camille, and maybe she should go and have further scans done just to rule out again.
Yeah.
Just wondering, yeah. If and also just blood labs would reveal a lot too. Yeah, just the basic CBC and metabolic panel and all of that could give you at least an indication. If everything was okay, she might not need scans, but I was just curious.
Yeah.
Yeah, and again, it's kind of funny. Western doctors always work from the cancer and the heart attack downwards, and we work, from the simple things upwards. So, it's a different approach, granted. But in terms of cancer, I will say this: people with cancer in abdominal organs, especially, or cancer that has metastasis, and I'm not suggesting this person has, I haven't seen the person, I'm not, but since it's coming up, a very typical finding on them is this sort of bloating, like you touch their abdomen, it feels like a bloated balloon, an overstretched balloon. That's very typical in later stage cancer people. But again, it's hard to say. We think that people are intelligent enough and that they would have, by now they would have figured it out. Like, how can you get to be late stage cancer? Granted, with the exception of pancreatic cancer. But I have actually seen people that sort of like suddenly one day, and it's stage 4, and and it's been there for years, blah, 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 blah. And I've seen doctors even. Things do go undetected, both mentally and in terms of actual, exams, because, we don't do ultrasound and CAT scans and stuff, all the time. It's not something that you just voluntarily go, by the way, I think I'll scan myself and see if there's any cancer today. This is not quite like the COVID test that we're waiting to have, that you can just like go, oh, no COVID, I'm good. It isn't like that. So it's definitely, certainly, this is one of the marks of this style is that we're very happy to take Western diagnosis, not necessarily the treatment always, but the diagnosis, absolutely worth it. It's not always correct, by the way. Fine, everybody makes mistakes, or sometimes it's not the full diagnosis, whatever. Unlike a lot of TCM people who say, I don't care what the Western diagnosis is, I only treat what is the Chinese pattern? I treat Chinese, don't treat, I'm very much into get all the information you possibly can from these people on the so-called Western side, who are paid well, have lots of equipment. They're really good at this stuff. They're good at diagnosis. You know, the treatments are sometimes not ones that I like, but in terms of diagnosing, great. Take all, you know, and I think that sometimes, you know, if I'm an herbalist or an acupuncturist, maybe I might have some resistance. It's still, just for the test, it's worth it sometimes.
Yeah, sure.
You know, and if then they say, by the way, would you like some chemo? You say, no, thank you, whatever. So, sorry.
Hallelujah to that.
Yeah. Well, you know, it's hard. Once you're in the situation, it's hard to say.
Yeah.
It's easy to
Yeah.
say no when you're not in it.
Indeed. Yeah.
Anyway, anyone else?
Can I ask
Yes.
questions? Maybe you could expand on the sphincter, and then you mentioned that you know, nervous system. So
Mhm.
I've got one lady who has got a really raw throat, and I think she has got a silent reflux, and because of the COVID, they haven't really checked it out properly, and then because it was so raw in the back of her throat, they first thought it was a cancer. So they did just check, went into the, I think it's just on top of the throat, not into the esophageal area. But then at least they have determined it, she doesn't really have any concerns about cancer. But this silent reflux, they're kind of temporarily diagnosing her. It's not going away, and she does react to her medication really, really badly, always after about 2 weeks. So she was on omeprazole, and she basically, her body just kind of shuts down, and she was having too much stomach ache, and then, you know, diarrhea and things like that she couldn't get on, and then she stopped taking it, and then she decided to have acupuncture at that point, and then she did have a couple of times acupuncture before for something else. She did respond really well for her anxiety and things like that. And this time, anxiety is better. She's eating better. She's accepting the foods better. But then that rawness in her throat is still there, and then always a permanent irritation. So what I have been using, because she doesn't want to lie down too much, she's so nervous that, you know, things are coming back to her throat and they irritate. So she, I can't really palpate her tummy, and there's not many painful points as such. So I'm just doing like a T5 and trying to release the neck, although she hasn't got any neck signs, but I'm just doing SEM, nervous system, because she is really anxious. And T5 and T11, is that the, I think in Kiko's book, it did say it works especially for acid reflux. It's related to anxiety, possibly. So yeah, so she had about 3 or 4 weeks continuous acupuncture, but it's not really quite shifting to the stage that she feels comfortable enough, and then redness is always there. So she started on the lansoprazole now. But
Sorry, what's that? She what?
It's another PPI. It's a lansoprazole.
Oh, okay.
Yeah.
All right. Well, and talking about these, you know, these that, you know, have they're reported to have cancer causing possibilities. So many people don't want to take them for too long, you know, so it's kind of problematic also, but separate story. So yeah, this is, it looks like this is, you know, it's a little bit like the, yeah, it's almost like, you know, there's fashions in these things. This seems to be one of the latest fashions. You know, this is like the post-GERD fashion. You know, people with this weird stuff in the throat that seems to be digestive related. So I must confess that I don't have like a clear bang. You know, you do this and I guarantee you it's gone, because it's this is something I would say you see a lot more of in the last 4 or 5 years. And yes, a lot of them do tend to show nervous system, you know, anxiety, you know, kind of stuff. Now, do you know what the blood pressure is for this person?
tends to be a bit low, but not
drastic.
not drastically low.
Okay.
Yeah.
Okay, because that's the other thing is when you're looking at autonomic nervous system, you're looking on the one hand at Sanjiao to release the SCM, that's one. You're looking at do 2 to release the spine, that's 2, but you're also looking at the spleen pericardium axis, which again is which blood pressure is one of them. So it's just always worth asking what's going on to give you some clues for treatment. So again, you know, if it's now where in the throat is the
She can
rawness?
see it, she says. So on top of the throat.
Okay, it's at very top, not
Yeah.
Okay. So
She can actually see it.
I would look into the spleen 3 pericardium possibility. You know, for esophagus, and also I would press rank 17 quite hard, not like you do for anxiety, but really hard.
Yeah, okay.
You know, because the esophagus will only show if you press it really hard, if you like pushing like the bone against it. But you know, this is way up at the top. So now, and you know, and check REN 12. So what I would do again is someone who doesn't want to lie down, you know, fine. If you can get them just for 1 second lying down and check what you can, and then move on. It's a good thing, but if not, no. So for REN 12, you're looking at kidney points plus immune point plus possibly stomach chi. Okay. Now, when you're looking at kidney point, now if you press here, okay.
Stomach 9?
Sorry?
Stomach 9 or
no,
whatever?
above, because you showed
Yeah,
above
above.
stomach 9. You showed like where the chin and the throat kind of meet. That's kind of where you showed above the Adam's apple, above the hyoid bone.
Okay.
If you poke there, is there anything there? Does she feel anything?
I haven't done that.
Okay, it's worth, you know, if they say I have pain here, it's always worth, you know, like, you know, touch very lightly and then you touch a little more, and you know, it's always worth finding out, because you know, unless they can say I can swallow and I can feel if they can say I can swallow saliva and I can feel the rawness, then you have a test. But if they can't, maybe by pressure you can, you know, find something. So that area should respond to kidney, because the kidney surrounds the throat. That's why we treat the thyroid with kidney points.
Yeah, I was thinking the kidney domain, the throat is anyway. So I did mix some of the kidney points with kidney 27 too. Yeah, kidney leg point and the kidney 27.
You don't have to do the 27. You could do the 27. You know, but I would look at kidney points and then your spleen pericardium. And yes, I would release sphincters. I would look at the state of REN 12 and look at immune point. And the other thing is sometimes these people, from my experience, there is some lung component nonetheless, even though it is digestive. So sometimes there's some relief that's gotten by lung 5, but I can't guarantee that that's like a real strong point. Then on the back, I do bladder 32, the Liao point.
Yeah.
Okay, and do 2. And then yes, T11, T12. Now, if you're looking specifically for a point in that area for NT5 because it relates to the stomach, yes, absolutely. If you're looking for a point that relates more to anxiety at the spleen level, it's not so much T11, T12, as much as bladder 49, the outer bladder shoe on the spleen level, needled upwards. That's, in my opinion, often better for anxiety than T11, T12. But quite honestly, because I do T11, T12 in almost everyone anyway, as well as T5. So what I would do is I would do T11, T12 plus bladder 49 upwards, plus T5, possibly T7 plus. I would do around bladder 17, find a place that's almost like a jumpy nodule. Like it almost
Jumpy nodule, did
jumpy.
you say?
Yeah. In other words, it has the quality of a nodule. There's a little puffiness there, but it also like moves. It's not just a nodule. You know, like for example, on liver 8, you're looking for just a puffy, just a nodule.
Mhm.
On bladder 17, maybe a little above, maybe a little bit outside or something, it's gonna move when you press it. It's not just puffy, it also, when you press it, it moves, it jumps a little bit.
Yeah. Okay.
So we call that autonomic nervous system shoe. And that might be worth adding.
Mhm. On the nodule itself, jumping.
Yes.
Yeah. Yeah. Okay. Yeah. Thank you.
And again, look at right side stomach, right side small intestine 11, because of you know, the assumption is this is digestive. You know, you're working on what the MDs are saying. And small intestine 11 is a good point to surround for digestion.
So even if there's no puffiness in small intestine 11 area, would you do that anyway?
I don't, depending.
Yeah. Okay.
I mean, if it's like no puffiness and it's like totally flat, it's a little bit like the spleen when spleen is totally flat. I'm not that interested in trying to needle into it.
Okay.
You know, the thing about small intestine 11 is it can move a fair amount. You know, it can be almost anywhere on the scapula. I mean, that's a slight exaggeration, but it doesn't, you know, so if there's really nothing puffy in that scapula, I would probably let it go.
Okay.
You know, and I would probably just go with small intestine 9-10, which is not related, but for the autonomic nervous system. Since I'm in the area already, I'm already palpating. So,
okay.
you
On
know,
both
just move
sides
2
or
more
just on
inches.
the right hand side?
Both sides. No, that will be
sides,
both sides, because you want to open the spine. You know, you want to open the nervous system on, you know, on both sides, sort of thing, not pull it in one direction.
Okay.
Those will be kind of like the ideas that I have. The other thing is, you can, for something like this, you could conceivably try do 24. The bladder 2 may not be as easy to work with here, because bladder 2 is really more for REN 17, REN 15 area diaphragm. And her symptom is very clearly in the throat, but we don't know if it's not coming from the other end of the esophagus and the sphincter. I mean, that's what the Western people are saying, is that they're thinking it's coming from the sphincter at the bottom.
Yeah, just because sphincter is not basically, you know, tight enough, and then it just lets the acid, I suppose, go up to as far as.
You know, if that were for the most part, my thinking would be, I don't know if it's the acid, although it could be, because if it was literally the acid, my thinking is that she would feel it in the chest first. She wouldn't say, I have something. It's like way at the top. But what can happen is the sphincter is not closing, or the sphincter is spasming. There may be a teeny bit of acid coming, you know, whatever, maybe not. And by the way, the fact that she doesn't respond to medication, that she has reversals of medications, suggests autonomic nervous system also. But that's just, you know. So again, I would look under the third toe, whether it's blood pressure related or not. I would still look under the third toe, especially if she, not if she has slow pulse, but if she has regular or rapid pulse, I would look under the third toe as a possible solution.
Okay.
But what I was going to say was, it's possible that the sphincter at the top of the stomach is doing something, and there's a vibration that reflects upwards, but I don't think it's literally acid going all the way from around just above REN 15 all the way up to here, to REN 23, and the person feels nothing. I mean, when you have acid, it feels like the bones of the chest are kind of like pushing. It doesn't, you know, so it's kind of, it will be a little odd to assume that, you know, and that's part of this interesting sort of, you know, it's often classified as GERD, but you know, it's a very, not fashionable is not the right word, but it's a very common symptom nowadays. You know, and it, you know, you didn't see it, you know, 15, 20 years ago so much. So I'm not sure what, you know, why, or is it, I don't know. But and it doesn't seem to be easy to treat. That's
No,
the other
it
problem.
doesn't. Yeah, and it just sort of came out of nowhere. I think she just could not eat at the first couple of weeks, and she lost about 2 stones. Just
Mm.
because there was this, I think it wasn't to start off with at the throat, and in the last 2 months it has been just basically here. But she was feeling sick, and she was feeling all sorts, and then even sinuses, and yeah, so it was strange, and I was really surprised that they didn't really want to investigate the sphincter, or any further investigation. But at the moment, people are trying to be just sort of got rid of from the waiting list. So just throw the medication at, and then see what happens. And if you don't take these medications, she's saying, I'm not agreeing with most of the medication. Is that good things to take? And they just don't want to know.
Yeah.
And then she's not healed. So I said, yeah, I don't know.
Yeah, it's hard. Yeah, it's hard when we're trying to do so many things through telemedicine,
Mm.
and also patients don't want to go to the doctor so much.
No,
Yeah.
not at the moment. But
Yeah.
and she's really so worried because they panicked at the beginning. Oh, is it cancer because it's so red? And so they were bothered at the
Oh,
point.
sorry. So it's
Yeah.
is it red on the skin or red inside?
Red inside, yeah.
Oh, okay.
So they were bothered until at that point, but then stopped further investigation. So
Weird.
yeah, it is weird, isn't it? Yeah, but I just keep saying, like, well, you think you're hustling them, but then I think you need to if you're worried about it, because
Yeah.
otherwise they're not going to look into it. So yeah.
Absolutely. You have to, unfortunately, one has to
Mm,
advocate for oneself, because the doctors won't, there's only so much they can do, especially right now.
mm,
When maybe so many of these meetings are done online,
mm.
then the patient is, it's a lot harder to say to the patient, don't worry when you're right in front of them. When you're through the computer, it's they become a non-person. So
Exactly.
I don't
Yeah,
know. Yeah, it's difficult. Yeah.
yeah. Thank you anyway.
Sorry. Anyone else?
No, good today, Abby.
All right. Well, enjoy your week.
Thank you,
And
Audrey.
it's very nice weather here. I don't know what it's like on the other side of the Atlantic. So we have an almost summer-like day today for it's been for a few days now. So
It's good.
We have your weather.
Better.
It was 34 degrees.
all right.